Urolithiasis or the kidney stones for USMLE. There are different types of stones which can be tested in different ways in USMLE. Let's talk about the general symptoms of all kind of kidney stones. The first one could be the stomach pain, the other could be back pain, and now the back pain could be migratory one. Like the patient can say they had a flank pain and then a back pain and then it was coming down to the groin. So this is migratory pain. As the stone moves in the tract, the urinary tract, the pain can get migratory. The vomiting, dizziness, fever, blood in urine are some common symptoms of the kidney stone. Let's study some different types of stones. The first one, the calcium one, which is the most common of all, and these are composed of calcium components, mostly calcium oxalate, which is most important for the USMLE. Sometimes other minerals such as calcium phosphate may also form stones, but the calcium phosphate is very low yield in terms of USMLE. Calcium stones may be caused by high calcium levels in the serum, which could be due to parathyroidism. High oxalate level can also cause increased risk of calcium stones. We'll see how. Uric acid stones. Uric acid stones are formed due to low urine output or the excessive intake of protein, especially red meat, alcohol intake, inflammatory bowel disease, or gout. This forms in the acidic urine, and they are not visualized by the plain X-rays. The plain X-rays does not visualize the uric acid stone, and that's why we also called it as radiolucent. If we talk about the struvite stone, this is a very large stone and usually occupies the complete renal pelvises. This type of stones are usually associated with urinary tract infections, the UTIs. They can grow very rapidly, forming a cast in the urinary tract, which we also called it as staghorn calculus. If left untreated, this can cause chronic infection and permanent kidney damage. The last one which we'll talk will be the cystine stone. This occurs due to inherent defect in the amino acid transport, and it manifests as recurrent stone in young patient. Now let's get deep dive into the calcium oxalate stone, which is the most common type of stone. There are different causes by which this can happen, but just for a idiopathic kidney stone, just a side note, if there is an idiopathic kidney stone, just remember that you will have two things: normal calcium level in serum, in blood, and the high calcium level in urine. So what we call it as normocalcemia and hypercalciuria, which will be most commonly seen if there is an idiopathic kidney stones. Now back to the calcium oxalate stones. The causes may include the calcium, which binds to the oxalate in the urine and allows us to excrete oxalate. So if the patient is taking low diet of calcium or has a state of malabsorption, oxalate can precipitate in urine. So what is a malabsorption state? Malabsorption state, the most common malabsorption disease that can cause this type of stone, the calcium oxalate stone, is Crohn's disease, which is the most common type. Let's talk in detail about how this Crohn's disease can lead to calcium oxalate stones. So this is a normal GI lumen. Normally what happens, there are fat molecules present in the GI tract which gets usually absorbed, and there are very less fat that is not absorbed in a normal condition, and there is presence of the oxalates in the normal GI tract. These are the oxalates molecule, and these are the fats. Now what happened? Now calcium comes and bind to the fat molecules as well as the oxalate molecules. So when calcium and oxalate binds, it usually is excreted in the feces. But now in malabsorption state, like Crohn's disease, in Crohn's disease, the fat molecules are not getting absorbed from the intestine. So there are many fat molecules present here. And there are oxalates that are present in the tract normally. Now what happens when calcium comes? Calcium usually gets chelated in the GI tract with the fat. So it will go and bind the fat molecules, and now there are many fat molecules. So the calcium gets used by attaching with the fat. So now you have many oxalates left unbind with the calcium, and now it cannot be excreted in the urine. So what happens? There will be increased reabsorption of the oxalate into the blood, and this oxalate will then go into the urinary tract, and in urinary tract it will bind to calcium, and it will form the calcium oxalate stones. So this is the mechanism how Crohn's disease can lead to calcium oxalate stones. So just to recap, so the calcium which was supposed to bind with the oxalate and excrete in the feces in a normal condition, now in malabsorption state, in like Crohn's disease, there are a lot of fat molecules. So calcium will attach with the fat molecules instead of the oxalate. So now there are lots of oxalate left unbind with the calcium, and they cannot be excreted in the stools. So the oxalates can get reabsorbed from the GI tract, will go into the urinary tract, and in urinary tract there is calcium, so it will get bind to the calcium, and now it will form the calcium oxalate stone. So the urinalysis may reveal the oxalate crystals. You may ask the patient to bring stones for the analysis, but that is very inconvenient. So usually first to do is a 24 hours urine collection to measure the urine calcium to detect hypercalciuria. Next thing you can check is the parathyroid hormone levels, PTH levels, which we said that if there is high PTH, there will be increased calcium, and increased calcium can eventually lead to the calcium oxalate stones. Now, treating could be hydration, analgesic for the pain, and thiazide is the main thing which can reduce the urinary calcium. How it will reduce the urinary calcium is that it will increase reabsorption of the calcium from the distal convoluted tubule. So thiazide's job is to reabsorb the calcium, and that's why there will be less calcium in the urine, and that will treat the calcium oxalate stones or any type of calcium stones. So treating the underlying cause is the final thing. If you have Crohn's disease, treat the Crohn's, and you will cure the calcium oxalate stones. So as we talk about the one more cause that is left is the hypercalcemia. The first thing we talk about was the primary hyperthyroidism. The primary hyperthyroid hormone can lead to increased calcium, that is hypercalcemia. But the other thing is malignancy that increases the calcium level, and it can cause hypercalcemia and then eventually lead to the calcium oxalate stones. Ethylene glycol, which is an antifreeze, and as well as hypervitaminosis C, can cause oxalate stones because it increases the oxalate level. And when we are talking about the thiazide can use to prevent the recurrence of the stone instead of treating it. How it can prevent the recurrence is by decrease the urinary calcium, because the main question that asked in the USMLE is that why does thiazide prevent recurrence of the stone, and always the answer is increased reabsorption of the calcium. And where is increased reabsorption of the calcium happening? In the distal convoluted tubules. So this was about the calcium oxalate stones. Now let's talk about the Struvite stones, or it is the magnesium ammonium phosphate stones. Now it is also called as staghorn calculi if it is large enough to obstruct the kidney ureter junction. It is caused by the protease. It is caused by protease urinary tract infection, which is the most common, which produces urease that breaks down the urea to ammonia and carbon dioxide, and then it can eventually lead to increased pH. The urinalysis reveals basic pH secondary to ammonia, and you might be getting confused that how does this happens. So let's talk about the urea which is present. Now the urease which is produced by the urease positive bacteria. The urease positive bacteria produces urease, and in presence of urease break down to ammonia and carbon dioxide, and this ammonia with water will give you ammonium and the OH minus molecule, which is basic in nature, and that will increase your pH level of urine, the basic urine. So this is how the urease leads to basic pH of the urine, which is secondary to ammonium. Urine culture may be helpful to detect the bacteria. Let's talk about the bacteria. What are the urease positive bacteria? The three main high yield bacteria that you should know for USMLE is Klebsiella, Serratia, and Proteus. These are the three main urease producing bacteria, or we call it as urease positive bacteria, which can cause these struvite stones. Now talking about the struvite stones, the clinical features usually associated are recurrent upper urinary tract infections, fever, dysuria, mild flank pain, more common than the renal colic. The urine pH will be more than 8. The pH which we said high will be more than 8 here. It will have the coffin lid shaped crystals, which the photo is the picture of the crystal. The coffin lid crystals look like this. And it is a large staghorn calculi, which is common but not that specific, and if we want to treat, it will be treated with Bactrim or ciprofloxacin that can be treated that can treat the bacteria like Klebsiella, Serratia, or Proteus. And the stone removal procedure, for example, percutaneous nephrolithotomy is usually required, because that is the seeding of the bacteria. If we don't clear the root cause, it will happen again and again. So removing the stone is the primary it is the usually the primary goal to treat this kind of stones. Also, one more thing, apart from the hydration, acidification of urine, and that could be done by ammonium chloride. So if you can give ammonium chloride to the patient, which will acidify the urine, and it will decrease the formation of struvite stone. And also, to just complete the calcium oxalate stone, treating the calcium oxalate stone could be one of the thing, could be alkalinization of urine can be done to treat the oxalate stones. And alkalization, because it is usually the calcium oxalate stone precipitate when there is acidic urine. So that makes sense that treatment could include alkalization along with the thiazide for prevention of recurrence. Hydration and analgesic is for generalized kidney stone treatment. So alkalization of the urine for calcium oxalate stone, and acidification of the urine for the struvite stone or the magnesium ammonium phosphate stone. This is a part 1 of the kidney stone. You can also watch my part 2, where we will talk about the uric acid stone, Christine stone, and the miscellaneous stones. Thank you.